I'm glad to get the chance to talk on this very important matter here this evening. And yes, this Health Insurance Amendment Bill 2023 is regarded as a pivotal piece of legislation in the ongoing effort to fine-tune risk equalisation credits and stamp duties within the private health insurance market. However, this bill does absolutely nothing to reduce the costs of private health insurance. In fact, this legislation is more about helping the insurance companies than about doing anything to help people with the challenges of affordability to health insurance, or indeed on the escalating costs of the public healthcare system. And I have it said before, Minister and Cathaoirleach, since Sean Quinn was forced out of the insurance market, the insurance companies are doing exactly what they like, because he provided competition and he gave insurance even to the motor industry, to the young fellas trying to get on the road that wasn't attainable at all at that time. And likewise, he was helping in the private health insurance as well. As I said, this bill does nothing to reduce the cost of private health insurance. The average adult policy has increased by at least 5% since last year. Year on year, it's going up 5%. And many are contacting me saying that even for a private appointment, if you have health insurance, Minister, you'll have to wait 6 months to be seen, which is absolutely ridiculous. So even though that you might have health insurance, you'll have to wait 6 months. And we know, all of us know, that cancer can, it can go from stage 1 to stage 2 to 3 to 4 very quickly if it isn't challenged or seen after, and the sooner the better. And at least people that have tried to pay their way and pay for the health insurance, they're not even being seen after now. And something has to happen. And I have several instances, Minister, where someone goes in, maybe unconscious, into the hospital. Something happens and they have to be taken away. We all know the story. Ambulance pulls up, take them away, put them into a ward. And when they come around, invariably, the first question they're asked, do you have health insurance? Well, maybe you don't know the purpose of why they ask that question. It's to ensure that the HSE gets the maximum for each time, and they have to sign a form, then the patient has to sign a form. So instead of maybe the HSE getting 70 or 80 euros for a day or a stay for a night in the hospital, the HSE can bill the health companies or the health insurance companies for something like 8 to 900 euros for the same night, Minister, for the same person. And why wouldn't health insurance go up then? 'Tis all a merry-go-round. The HSE will charge so much more to the health insurance companies than if they were asking the private person to pay it, and the level of care doesn't go up or get better. So that's one of the reasons why health insurance is increasing, and the other one, of course, is that there's no competition in the market. Private health insurance market, which opened to competition in 1994, features 3 major providers: VHI Healthcare, Leah Healthcare and Irish Life Healthcare. Market data highlights that 3% in the growth in the market during 2022, with 79,553 more insured individuals compared to the previous year. The total premium income for 22 reached 2.9 billion. As of June 2023, 47.6% of the population, 2.46 million, held health insurance, with the average adult policy priced at €1,509, reflecting a 5% increased this year. The tax relief which people got from having health insurance, resulting in 355.3 million of foregone taxes in 2019. The Commission on Taxation and Welfare 2022 suggests phasing out this tax relief. God Almighty, Minister, when is enough? Enough. As part of the ongoing implementation of Slantercare's healthcare reform recommendations, this is something I do not support. This is something that many TDs in our own party do not support, Minister. This is and this has to be halted. All our group are adamant that the tax relief must remain, because if it doesn't, many people won't be able to afford the private health insurance. The Health Insurance Authority, HIA, not only serves as the regulatory body overseeing the private health insurance market, but is also essential advice to the Minister for Health on health insurance matters, including duty and the risk equalisation scheme. Concerning trends, Irish Life has announced its third price increase in the past 12 months, with the latest surge of 4.8% to be implemented in January 2024. Minister, look, it's very clear that the health insurance system that we have is not effective. There is not enough competition, and the story is that it is not helping people that even have it, because they can't. They don't get any reward for having it. They have to wait 6 months to 12 months, the same as people on the public waiting list. So it's not right, and I don't begrudge the people on the public waiting list. They must be seen after as well. But these people that are paying are not getting any reward for it. Now, Minister, I have another thing to raise with you in relation to, and you are likely to be aware, management and administration, great staff enforcer union in the HSE commenced industrial action on Friday the 6th of October. Unfortunately, one of the areas affected is the processing and answering of parliamentary questions and representations. That is hurting me, Minister, and it is hurting every other public representative, and especially in the areas of home help. And I had a very simple request on or about the 7th or 8th of October, where a family, the woman of the house is seriously ill, and the family have all the stops pulled out to try to assist that woman. And she was always got up around 8 o'clock to 8:30. She's after getting notification now that the home help won't come to help the family member that's staying at home to get that woman out of bed until 11 o'clock. And the home help won't come back again till 5 o'clock, and we'll come back in at 5 o'clock in the evening. And what the family are saying is that this amount of time in bed is not good for her. The day is too long in bed from the time she goes to bed in early evening and has got up in late morning, and it was a very simple request. And can I get an answer about that since? Minister, that's not fair. That's not fair, and I'm asking you to deal with whatever gripe or grudge they have or whatever concern they have, and they have, because they're saying that they're not being recognised and not being paid for the grade that they're working for. And the other thing then, Minister, and this is a fact, and I'll call it out one of these days if it didn't sort it out. I have been reliably told by the home helps, who will not leave, and I have to compliment them. They do their work so diligently. But they have been told by their manager that they won't be paid for the overtime they have worked. And they helped the people that went off sick and took their place. They wouldn't like to see the patients short-changed or not seen after. And they went to help their comrades that were off sick or had to go somewhere. And then they were told by the manager that they weren't going to be paid for the overtime. There's a lot of talk. There's been a lot of talk inside this chamber about trying to keep people in their homes as long as possible. And they are actually saving the state a fortune when they don't go into hospitals. But I'm asking Minister to sort this out. You're saying that they have funds. He gave them more funds the other day at the HSE. But someone has to be responsible and call them out for what they're not doing. They're not helping the patients and the healthcare system in our county. In many parts of it, the people are being short-changed, Minister. And I have a lot more to say. There's another motion later on, and I'll come to a couple of I'll highlight a couple of other very serious things, because the care of our elderly people is of paramount importance.